This medication, Temodar Vial, is used to treat specific types of brain cancer. It belongs to a class of drugs called alkylating agents, and it works by slowing or stopping the growth of cancer cells. It is important to take this medication exactly as prescribed by your doctor. The dosage and schedule may vary based on your medical condition and response to treatment. It is usually taken once a day on an empty stomach, at least 1 hour before or 2 hours after a meal. Be sure to follow your doctor's instructions carefully. If you have any questions or concerns about taking Temodar Vial, be sure to talk to your healthcare provider. Before you start using Temodar Vial, make sure to read the patient information leaflet if available from your pharmacist. This medication is given by injection into a vein as directed by your doctor, usually over 90 minutes. The dosage and treatment schedule are based on your medical condition, height, weight, and response to treatment. To get the most benefit, carefully follow the dosing schedule as directed by your doctor. Remember to mark your calendar to keep track of when to receive the next dose. Your doctor may also prescribe other medications to help prevent infection or side effects, so make sure to follow their directions for taking all your medications. Some common side effects of Temodar Vial may include nausea, vomiting, loss of appetite, mouth sores, changes in taste, constipation, tiredness, dizziness, trouble sleeping, headache, or pain/redness/swelling at the injection site. If you experience severe nausea and vomiting, your doctor may prescribe medication to help. Eating small meals and limiting activity may also help lessen these effects. Temporary hair loss may occur, but normal hair growth should return after treatment. It's important to note that taking Temodar Vial may have serious side effects, but your doctor has prescribed it because the benefits outweigh the risks. Your doctor may monitor you closely to decrease your risk. While it's used to treat cancer, it may rarely increase the risk of other cancers and decrease bone marrow function, leading to low blood cell count. Contact your doctor if you notice symptoms such as unusual tiredness, signs of infection, or easy bruising/bleeding. Seek medical help immediately if you experience symptoms of liver damage or have a seizure. Although rare, a serious allergic reaction is possible, so seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor if you notice any other effects. Before taking Temodar Vial, make sure to inform your doctor or pharmacist about any allergies you may have. Also, discuss your medical history, especially if you have kidney or liver problems, bleeding issues, or a weakened immune system. While using Temodar Vial, you may be more susceptible to infections, so it's important to avoid contact with people who have contagious illnesses. Additionally, let your healthcare professional know if you are planning to receive any vaccinations. Be cautious with sharp objects and avoid contact sports to prevent injuries while on this medication. Also, be aware that Temodar Vial may cause dizziness, so avoid alcohol, marijuana, or activities that require alertness. If you are a woman of childbearing age, reliable birth control is necessary during treatment and for 6 months after the last dose. For men, it's important to avoid donating sperm while using Temodar Vial and for 3 months after stopping the medication. Pregnancy should be avoided while taking this medication, as it may harm an unborn baby. If you become pregnant or are planning to become pregnant, speak with your doctor immediately to discuss the risks and benefits. Breastfeeding is also not recommended while using Temodar Vial. When taking Temodar Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medications without consulting your doctor first. This will help ensure the safe and effective use of Temodar Vial. If you suspect an overdose or serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical help by calling 911 or a poison control center. For U.S. residents, the local poison control center can be reached at 1-800-222-1222, while Canadian residents can call their provincial poison control center. Before starting on Temodar Vial, it's important to have lab and/or medical tests, including a complete blood count, liver function, and brain scan. These tests should also be done while using the medication. It's essential to keep all medical and lab appointments to ensure the medication is working effectively. Remember, it's crucial to take each dose of Temodar Vial as prescribed. If you happen to miss a dose, make sure to consult your doctor or pharmacist for a new dosing schedule. Do not try to make up for the missed dose by taking a double dose. It's important to follow the prescribed schedule for the best results. This medication is administered in a medical facility and should not be stored at home. It is used to treat certain types of brain tumors in adults. The dosage and timing of administration will be determined by a healthcare professional. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.